Hi everyone. Did you know that you are now statistically more likely to die from an opioid overdose than a car crash? About 130 Americans die every day from an opioid overdose. Close to 50,000 died in 2017. So where did the opioid epidemic come from? In the 1990s, pharmaceutical companies touted the effects of newly developed opioids as safe and effective for the treatment of chronic pain. Basically everyone, including the FDA, went along with that perspective, as the pharmaceutical company continued to develop more and more powerful opioids like fentanyl. Now, we know that these opioids have a number of nasty side effects, including a high risk of overdose and death. We also know that they are not all that effective, especially for chronic pain. In fact, over time, opioids may actually make chronic pain worse. There are now a number of initiatives at the federal level to combat the opioid epidemic. So what about cannabis? Does cannabis have a role to play in terms of combating the opioid epidemic? States like Illinois and New Jersey think so. They have passed laws recently encouraging the use of cannabis products rather than opioids. While we do not have solid research on whether cannabis products might help people cut back or quit opioids, there are a number of studies that suggest patients are trying to use cannabis to kick the opioid habit. And it kind of makes sense. If you're struggling with chronic pain and opioids, what do you have to lose? The risk of developing a cannabis use disorder is probably not one of the things you are most worried about. You are worried about a fatal overdose. Remember, the odds of dying from an overdose are now greater than dying from a car crash. You are worried about serious withdrawal. You are worried that you may never get off opioids. When weighing the potential harm of cannabis versus opioids, one thing is pretty clear: opioids are more harmful than cannabis. While it's unequivocally true that carefully controlled studies on the effects of cannabis as a treatment for opioid use disorder have yet to be done, it is completely understandable why someone would want to try it. And it's not surprising that states like Illinois and New York, New Jersey are encouraging it. In this module, we review evidence suggesting that states with medical cannabis laws see fewer prescriptions for opioids. We review evidence to suggest that patients are actually using cannabis in an effort to self-treat their opioid use disorder. We will review animal and human studies on the opioid-sparing effect of cannabis, and we will talk about the need for careful research in this area. We will also review a couple of studies that are often cited by detractors of the theory that cannabis might be somewhat useful in the opioid epidemic. Finally, we will hear from a rising star in the area of opioid cannabis research, Dr. Ziva Cooper, who will describe her recent work on the opioid-sparing effect of cannabinoids. The opioid epidemic is one of the biggest threats to public health in our country right now. I hope that you find this module useful and informative. So first, we're going to talk about opioid use disorder in this module, and in this lecture we're talking we're going to talk about opioid use disorder in this module, and in this lecture we're talking about basically what is opioid use disorder, and we're going to start off with opioid basics. So opioids 101. What are prescription opioids? So prescription opioids can be prescribed by doctors to treat moderate to severe pain, but of course these opioids also can have serious risks and side effects. Some common types, you've probably heard of these: oxycodone or OxyContin, hydrocodone or Vicodin, morphine, and methadone. Heroin is an illegal opioid, and the use of heroin has increased across the United States among men and women, most age groups, and all income levels. You've probably heard of fentanyl in the news. Fentanyl is a synthetic opioid pain reliever. It is many times more powerful than other opioids. It's approved for treating severe pain, typically advanced cancer pain. Illegal fentanyl has been on the rise, as have overdose deaths. So basically what's happened is that gangs in other countries have figured out how to illegally manufacture fentanyl and smuggle it into the U.S. and sell it in the black market. And because of that, we've seen a rapid rise in overdose deaths. Some more basics. Note that I'm using the term opioid, which refers to both natural and synthetic substances that act at one of the three main opioid receptor types. The three receptor types are mu, kappa, and delta opioid receptors. Opioids can have analgesic and central nervous system depressant effects, as well as the potential to cause euphoria. Opiate, on the other hand, refers to a subclass of opioids consisting of alkaloid compounds that occur naturally in the opium poppy. These include morphine and codeine. Heroin, on the other hand, is a derivative of morphine and is the opioid most commonly abused by injection. The chemical name for heroin is diacetylmorphine. Synthetic opioids are things like oxycodone and hydrocodone, which are sort of semi-synthetic. Other sort of full-blown synthetic opioids include fentanyl, tramadol, and methadone. So what is opioid use disorder? Natural and synthetic substances that act at one of the three main opioid receptor types. The three receptor types are mu, kappa, and delta opioid receptors. Opioids can have analgesic and central nervous system depressant effects, as well as the potential to cause euphoria. Opiate, on the other hand, refers to a subclass of opioids consisting of alkaloid compounds that occur naturally in the opium poppy. Most commonly abused by injection. The chemical name for heroin is diacetylmorphine. Synthetic opioids are things like oxycodone and hydrocodone, which are sort of semi-synthetic. Other sort of full-blown synthetic opioids include fentanyl, tramadol, and methadone. So what is opioid use disorder? Well, about 2.1 million Americans had or met criteria for opioid use disorder in 2016. Opioid use disorder is defined in the DSM-5 as a problematic pattern of opioid use leading to clinically significant impairment or distress. Opioid use disorder was previously classified as opioid abuse or opioid dependence, and that was in the manual that came before the DSM-5 or the DSM-4. So opioid use disorder is defined as having two or more of the following symptoms within 12 months. So this is the list of symptoms here. Using larger amounts of opioids or using them over a longer period of time than was intended, persistent desire to cut down or unsuccessful attempts to control use, great deal of time spent obtaining or using or recovering from use, craving or a strong desire or urge to use, failure to fulfill major role obligations because of opioid use, continued use despite recurrent or persistent social or interpersonal problems, giving up or reducing social, occupational, or recreational activities, recurrently using in hazardous situations, continuing to use despite physical or psychological problems, tolerance, which basically means you need an increase in the amount of the drug to get the same effect, or it means you're getting less of an effect with the same amount of the drug. And withdrawal syndrome, which is manifested by cessation of opioids, and basically to relieve or avoid withdrawal symptoms. Okay, so a couple of important notes about opioid use disorder. Tolerance and withdrawal criteria are not considered for those taking opioids solely under appropriate medical supervision, and severity of opioid use disorder is categorized as mild if there are only 2 to 3 symptoms, moderate if there are 4 to 5 symptoms, or severe if there are 6 or more symptoms. So what is the opioid epidemic in the United States, and where does it come from? Well, in the late 1990s, pharmaceutical companies assured the medical community that patients would not become addicted to opioid pain relievers. Consequently, healthcare providers began to prescribe opioids at greater rates. This corresponded with, of course, the increase in chronic pain. Increased prescription of opioid medications basically then began to lead to widespread misuse of both prescription and non-prescription opioids. And it later became crystal clear, that these medications could be highly addictive. So that was the genesis, the start of the opioid crisis. Just to give you some statistics in terms of how bad it is, roughly 21 to 29% of patients prescribed opioids for pain end up misusing them. Between 8 and 12% will develop an opioid use disorder. Between 4 and 6% who misuse prescription opioids eventually transition to heroin. About 80% of people who use heroin first misuse prescription opioids. Opioid overdoses increased 30% from July 2016 through September of 2017. That's like just a little bit more than a year. Increased 30%. Although this is specifically in 52 areas in 45 states. So in some parts of the country, it basically shot up between 2016 and 2017. The Midwest saw opioid overdoses increase 70% during a similar time frame. And opioid overdoses in large cities increased by 54% in 16 states. So we have seen a rapid increase in the problem with respect to the epidemic in the middle of 2016 to 2017. So in 2017, we had over 70,000 drug overdose deaths in the U.S. Opioids, mainly synthetic opioids, other than methadone, were the main driver of those overdose deaths. So opioids were involved in about 47,600 deaths out of the 70,200 deaths. There was also a 30% increase in emergency department visits for overdoses, and people who have had at least one overdose